All right, welcome to the Explainer. Today, we're going to decode one of the body's most direct messages, the pulse. We'll cover what it is, how to measure it, and most importantly, what that vital story it's telling you actually means. You know, every single beat you feel, that's a direct message from the heart. It's a key piece of the clinical puzzle. So learning to accurately read that message isn't just a task you have to do. It's an absolutely essential skill for any healthcare professional. So, what exactly is a pulse when you get right down to it? Well, think of it this way. With every single beat, the heart's powerful left ventricle shoves blood out into the body. This creates a pressure wave, kind of like a ripple in a pond, that travels through your arteries. And that wave, that's exactly what you're feeling on the surface. So, why does this one simple beat matter so much? Well, it's like a direct window into the entire cardiovascular system. It gives us instant, real-time feedback on heart rate, how efficiently the heart is pumping, and just the overall status of a person's circulation. Now, here's something you've got to remember. A normal pulse isn't some one-size-fits-all number. Just look at how dramatically that resting rate changes from a newborn all the way to an older adult. But for your exams, for most clinical settings, that magic number you need to remember is the adult range, 60 to 100 beats per minute. Okay, but here's the thing. Measuring a pulse is so much more than just counting beats. To really get the full story, to understand the message the heart is sending, we need to look at 5 key characteristics every single time. So let's break them down. We're going to look at rate, rhythm, volume, tension, and equality. Getting these down is what takes you from just counting to doing a real thorough clinical assessment. First up, we have rate. Basically, how fast is it going? And it's not just about is it normal. We got to know how to spot tachycardia, that's a heart that's going too fast, over 100 beats a minute, and bradycardia, which is a heart that's too slow, under 60. And understanding what could be causing it, whether it's a fever or just someone who's really fit, gives you huge clinical clues. And here is an absolute classic for your exams, a huge clinical rule to lock away. Just remember this. For every 1 degree Celsius your patient's temperature goes up, the pulse is going to jump by about 10 beats a minute. It's a super useful shortcut. All right, next up is rhythm. And this is all about the pattern. Is it steady? Is it predictable? A regular pulse is like a metronome, just tick-tock, steady as it goes. But an irregular one, that could be a sign of an arrhythmia or some other problem that definitely needs a closer look. And this leads to a non-negotiable, absolutely critical rule in nursing. You can never estimate an irregular pulse. If you feel that irregularity at the wrist, you have to go straight to the source. You listen to the apical pulse, right at the heart, with a stethoscope for 1 full minute. No shortcuts. Number 3 is volume. This is all about the strength or the force behind that beat. And this isn't just a gut feeling, right? We use an actual graded scale. It goes from 0, meaning no pulse at all, to a nice normal 2+, and all the way up to a 4+, which we call a bounding pulse. You'd feel that in someone with, say, fluid overload or high blood pressure. Okay, last 2 characteristics, tension and equality. So tension is about how that artery feels under your fingers. Is it soft, easy to compress, or is it hard, kind of like a little wire? That could point to hypertension. And then there's equality. This one's simple but crucial. You're just comparing the pulses on both sides of the body. They should feel the same. If one's weaker than the other, that's a huge red flag for a blockage or some other circulatory problem. All right, so we know what we're looking for. Now let's get into the how and the where, the actual hands-on skill of finding and feeling that pulse correctly. So look, the radial artery on the wrist, that's our bread and butter, the one we use for routine checks. But you absolutely have to know all these other sites and why we use them, like the carotid in the neck for emergencies, and pay close attention to the apical site. That's the most accurate for any kid under 2 and for our cardiac patients. Okay, before we even think about the steps, there is one golden rule. You have to get this. Never use your thumb. Why? Because your thumb has its own pulse. It's strong enough that you'll feel it, and you'll end up counting your own heartbeat. Total rookie mistake. So the actual process is pretty straightforward if you do it the same way every time. First, prepare. Make sure your patient is calm and relaxed. Then, locate the pulse using your index and middle fingers, never the thumb, right? Now, if the rhythm feels regular, you can count for 30 seconds and just double it. But if it's irregular, you absolutely have to count for the full 60 seconds. And then, you're not done. You assess all those other characteristics we talked about, the rhythm, the volume, and you document everything accurately.
Sometimes our fingers just can't tell us the whole story. To really hear what's going on, especially for that super important apical pulse, we need to bring in the essential toolkit. And that means the stethoscope. Think of a stethoscope as your superpower. It's your hearing, just amplified. The fancy medical term is auscultation, which is really just listening to what's happening inside the body. It lets you gather clues you could never get just by touch.
Okay, pop quiz time. The chess piece has two sides, right? And knowing when to use which is a classic exam question. So you've got the big, flat side, that's the diaphragm. You press that firmly for high-pitched sounds. Think normal heart sounds, lung sounds, bowel sounds. Then you've got the smaller, cupped side. That's the bell. You use that with light pressure to pick up low-pitched sounds, like heart murmurs. Big difference.
And man, this one tool does so much. You need it for that apical pulse, for hearing heart murmurs, for assessing lungs, checking on the gut, even for taking a really accurate blood pressure. It just opens up a whole world of diagnostic information.
So that's the rundown. Assessing a pulse, it's so much more than just a task you check off a list, isn't it? When you really master this skill, you're not just getting a number. You're learning to listen. You're tuning into the incredible stories the body is telling you all the time.